Today we will discuss about causes for snoring in children. So snoring in children can be caused by several factors ranging from anatomical issues or environmental influences. Some common causes include one of the most frequent causes of snoring in children is enlarged tonsils or adenoids. These can block the airway, leading to noisy breathing during sleep. Allergies, colds, and sinus infection can cause nasal congestion, making it difficult for children to breathe through their nose, which can result in snoring. Being overweight can increase the likelihood of snoring due to excess fatty tissue around the neck and throat, which may obstruct airflow during sleep. Sleeping on the back can cause the tongue and soft tissues of the throat to collapse backwards, obstructing airflow and leading to snoring. In some cases, children born prematurely may have underdeveloped airways or breathing issues that can contribute to snoring. Inconsistent sleep schedules, lack of enough sleep, or sleep deprivation can also increase the likelihood of snoring in children. If a child's snoring is loud, persistent, or associated with breathing pauses or choking sounds, it's a good idea to consult nearby ENT specialists to rule out conditions like sleep apnea or other underlying issues.